Hi, I'm Dr. David Morris with Magnolia Medical Center, and I want to thank you for taking time to watch this video. If you're watching this video, you or a loved one suffering with any condition related to female hormones, whether it be menstrual cycle issues, fertility issues, you name it. And this video is going to answer a lot of questions for you. In the main body of this video, I look at a little bit younger than I do now because we changed this introduction a little bit because our clinic has evolved. We're very proud of our success rate in helping people that have complex hormone-related issues. And we've been very, very successful at helping women and men overcome hormone-related disorders. The video that I made was some years ago, and the science in the physiology and the information in that video has not changed, but our clinic has evolved. We've been so successful that we've actually had to hire other providers, and we're very proud that the success of our clinic has allowed us to do that. So we've altered this video slightly in the beginning here with this introduction, but there's also some edits to the end of this video that you're going to want to watch. So if you're watching this, you need to watch the whole video. I know it's a little bit long, but watch the whole entire video. If our approach and this approach makes sense to you, then at that point you should give us a call. Provided you watch the whole video, you should give us a call to see if we might be able to help you deal with whatever issues you're having related to female or male related hormones. This video is very much geared towards the female hormone issues. One thing you should know here on the front end is our clinic is a functional medicine clinic. And I go over all of the approach in the video. But a functional medicine approach means we're not here just to provide somebody with a hormone replacement, doing pellets or creams without actually finding the underlying cause. So if you're going to watch this video in hopes that you're going to come to a clinic that the only thing we do or the main thing we do is provide hormone replacement, bioidentical hormone replacement, that is not the main thing we do at all. We really want to get to the bottom of the problem. So watch this whole video. Again, I know it's a little bit long. Watch it all the way till the end. And you'll see the a little bit older me later on in the back end of this video. Thanks for watching. Hi, I'm Dr. David Morris, and if you're watching this, either you or a loved one suffers from, or you think you might suffer from, hormone imbalances. I'm going to talk to you today, and it is going to be a lot of information, so get a pen and paper if you want to take some notes. This is a condition that is very much misunderstood, not only by the general public, but by a lot of other doctors. So I'm going to be giving you a lot of information. I'm going to talk to you kind of fast, but I hope that you get the gist of it. So we'll go ahead and get started. At our clinic with functional medicine, we're very much interested in treating chronic illnesses. And a lot of chronic illnesses for females involve the balance of estrogen, progesterone, and testosterone. And we're going to be talking a lot about that today. This is all about women, all women, those who are having periods, cycling females, perimenopausal women, where there's a lot of problems that occur, and even postmenopausal women. So we're going to cover all types of female hormone issues. Now, just on the side of full disclosure, I'm a chiropractic physician and a functional medicine practitioner. I cannot and do not prescribe any hormones. At Magnolia Medical Center, my clinic, we have a nurse practitioner and a medical director, a medical doctor that can handle that aspect of someone's treatment. But in all fairness, as a chiropractor, I'm not going to adjust your hormones into balance. So don't go down that road either. At our office, we believe the first step in handling any condition is getting educated about it, learning about it. And as functional medicine providers, we look at getting to the underlying causes of the conditions. So this video is meant to teach you about your hormones, why they might be out of balance, some of the symptoms related to hormone imbalances, and what can be done to get them back into balance. I want to make sure you watch this video all the way through so you can find out what you can do to handle this problem. Again, at the end of this video, I'm going to tell you what you need to do to get started handling these issues. All right, now there's a couple of books that I really recommend for the general public. And even for doctors to get a good understanding of these problems. One is What Your Doctor May Not Tell You About Menopause by Dr. John Lee. He was really the pioneer behind a lot of what we're going to be talking about today, and he revolutionized how we looked at female hormones. Another book is Natural Hormone Balance for Women by Dr. Uzi Reese. Now, some things you need to know. What is a hormone? A hormone is really a messenger, a chemical messenger that transports a signal from one cell to the next, like a neurotransmitter does in your brain. Now, the hormones that we're going to be talking about today are estrogen, progesterone, and testosterone. And yes, ladies, you do have testosterone, and yes, it is important. Men have progesterone and estrogen, so they are also important for men. Well, we just don't have as much as you, ladies. So, and ladies, you don't have as much testosterone as men. Now, we also need you to have an understanding of how the thyroid hormones interplays with this, and these guys, and insulin and cortisol, and another adrenal hormone called DHEA. Now, one of the things that we see with women with chronic illnesses is a lot of them, women, have their hormones really in a disarray, and chronic illness in our healthcare system. Folks, our healthcare system really isn't all that good at treating chronic illnesses. We're very good at treating acute problems like injuries or heart attacks or infections. We're very good at that in our healthcare system, but our healthcare system is very pharmaceutically driven. And pharmaceuticals don't really do a good job when you have chronic underlying conditions. You're going to learn today that if you have hormone imbalances, it very well means that you also have underlying issues, other underlying stuff. It is a downstream problem, so the problem could be somewhere else in the body creating a hormone imbalance. Over 133 million Americans suffer from chronic illness, and that is a little over a third of our population, and yet 99% of our government's healthcare sector budget is used to treat illness after it occurs, even though the vast majority of chronic illnesses are preventable. Now, why is this? Why would you put 99% of our money into treating something after it occurs? We certainly don't want to do that with our cars or your air conditioning at home or equipment that you have. We try to prevent things. The reason why is because our healthcare system and our healthcare insurance is pharmaceutically driven. And the pharmaceutical companies, and I hate to sound like a conspiracy theory person, but it's just the truth, they drive the whole system. They lobby Congress and politicians, and they get these laws passed so it is profitable for them. And there's no money to be made in prevention. Pharmaceutical companies have no vested interest in preventing illness, and you need to be aware of that. And it's just super important, and your awareness is important on that. If you're not aware of that and you don't believe me, then I have to tell you, you're probably a little naive, because that is the way it exists right now, and that's just the way it is. So don't count on your doctor understanding what I'm going to be telling you today. Many of them are trying to learn this, but don't count on it, because many of them do not already know this. In fact, they've done studies that the average doctor, including chiropractors or any type of doctor, is about 13 years behind on scientific literature. They're busy with their practices, they're enjoying their families and whatnot. Folks, I'm not one of those doctors behind on research. My wife thinks I'm a geek because I like to research these conditions. It helps me get the great results we get in my clinic. This stuff I'm telling you today is absolutely in the scientific literature. It is not my philosophy or my opinion. It is just absolutely the facts. I want you to know that if you're suffering from hormone imbalances, there are some very, very simple ways from a functional medicine point of view to correct them and really get your life back. So what does this mean for you? If you want quality care for a chronic condition, you are going to have to think outside your insurance company. I hear this all the time, but I'm telling you up front that if you want quality care for a chronic condition, you're going to have to pay for a lot of it, because the insurance industry and their healthcare system and pharmaceuticals is not geared towards these problems. They're not really good at getting to the cause of them. Most of you know that, or you wouldn't be watching this right now, but don't shoot the messenger. Now let's look a little bit at the female hormone cycle. When you're cycling, this does not apply to menopausal women. We will talk about that later. But the main thing I want you to understand from this picture here is that the estrogen and progesterone really fluctuate depending on where you are in your cycle. Now we know that the first day of your cycle is the first day of bleeding. And that is when estrogen and progesterone are at their lowest. And what happens is during the first 14 days of the cycle, this is called the follicular phase. This is when the ovaries are developing a follicle. what happens is estrogen, this thing right here, it comes up. And as it rises, there's a peak in the estrogen. And that peak causes the release of another hormone from the brain called luteinizing hormone. And that causes the egg to erupt from the developing follicle, and then the egg goes into the fallopian tube to meet with some sperm, and then conception occurs. And then the fetus goes into the uterus for implantation. Now, really, the whole purpose of the female hormone cycle and your menstrual cycle is to ovulate and produce an egg so that the egg can be fertilized, so that this thing we call humankind keeps going on and on and on. So now, estrogen is the hormone that is predominant in the first 14 days of your cycle. And when you think of estrogen, I want you to think growth. It is there to grow the egg, and it is there to grow the endometrium, the inner lining of your uterus, so that if you get pregnant, the baby can live there. So this peak of estrogen is stimulated, and then the egg erupts from the follicle, and that egg goes into the fallopian tube. Now, when the egg erupts from the follicle, here, that follicle now is called a corpus luteum, which means yellow body in Latin. And that is it's a very important thing. The corpus luteum is the major source of progesterone in a woman's body. Think of progesterone as pro-gestation. It's all about gestation and pregnancy. So the corpus luteum evolves from the follicle, and then progesterone dominates in the second half of your cycle, which is called the luteal phase of the menstrual cycle. So estrogen is the first half, progesterone is the second half of the cycle. If you're having problems anywhere in your cycle, it is usually because one of these is too low or too high. So then progesterone, what it does is it nourishes the endometrial lining, the thickening of the endometrium. After about 14 days, if you don't get pregnant, the brain gets it that you're not pregnant, so the endometrial lining sloughs off and you have your period, the menstrual flow. If you do get pregnant, what happens is the placenta starts to grow, and then the placenta becomes the source of progesterone. When you get pregnant, when a woman is pregnant, her progesterone levels are 300 to 400 times higher than they are when you're not pregnant. And this is why a lot of women feel very good when they're pregnant. Now, maybe not in the first trimester, but later on in the pregnancy, they feel good because their progesterone levels are so high. So when you're going to talk about this balance, so we're going to talk about this balance, but the main thing that I want you to understand, the key point, is that estrogen and progesterone levels fluctuate throughout the month if you're cycling. If you're in menopause, then they are not fluctuating, but we're going to talk about that later. So how can you determine when your imbalance occurs? All right. If you're a cycling woman, we do a 28-day comprehensive female saliva test. We do saliva here because that is the best way to measure our hormones over time, and we collect the saliva every few days. So when your period starts, we have you spit into a tube, and then every other day, every 3 days, we collect that, and it is a wonderful test, amazing test, because we can see exactly where your levels are off. And then we can use bioidentical hormones if they're needed, which we'll talk about later. It's very important that they're not synthetic, but bioidentical. There's an apples to orange relationship there. So the saliva measures the free fraction or the active form of the hormone, and it tells us exactly what and where the imbalance is. Now, many of you may be watching this and you're on progesterone creams or estrogen creams. You need to understand that if your doctor is monitoring your hormone levels through serum or blood, that this is not going to give you an accurate picture, because when you use creams, a lot of the hormone doesn't even go into your blood. It never reaches your blood. It goes directly into the tissues right away, and we can see that through saliva testing or even urine testing. So your hormone levels, if you're going to be using creams, are going to be falsely low if your doctor is looking at blood tests for your hormones. So a lot of times women come to me and they have been on estrogen or progesterone cream or birth control pills, and they're checking their blood, and the doctors are checking their blood. So we use saliva or urine, and those levels are 8 to 10 times higher than they think they are, because they only looked at them in blood previously. So anyone who knows what they're doing with female hormones is going to always check using saliva or urine and not blood. When doctors are using blood, I hate to say it, ladies, and I don't want to make anyone mad here, especially doctors out there, but the doctors he or she they might not know what they're doing if they're checking blood. So The symptoms of female hormone imbalance: fat, fatigue, depressed. Ladies, you're never going to lose weight if your hormones are out of balance. Cravings for food, compulsive eating, low sex drive, you're emotional, PMS, hot flashes, night sweats, insomnia, irritability, bloating, weight gain, sometimes without changes in your diet, starting to drink more to relax yourself, irrational thoughts. Anxiety is a huge one. Dry skin, hair loss, poor bladder control, osteoporosis, hugely related to your estrogen and progesterone balance. Heart disease, infertility, irregular cycles, and so on. Not a good way to live. The key point that I want to make is female hormone imbalances don't just happen by themselves. There are underlying stressors that are causing the imbalance that have to be identified and addressed. This is what makes our clinic so different from other clinics that do hormone replacement therapy. We insist on getting to the upstream causes of the problems so we can minimize or prevent the use of drugs and even hormones when possible. So, let's talk about some of the underlying causes of female hormone imbalances. Your adrenal glands, ladies. When you go into menopause, almost all of your hormones and all your estrogen and progesterone and testosterone are coming from your adrenal glands. By the way, menopause is not a disease. It is a natural flow of life, just like puberty is. So sometimes I think we get this misconception that menopause is this disease, this dreaded thing. And your adrenal glands, they make two very important hormones, cortisol and DHEA. If the body is under stress, and I'm not just talking about emotional stress, but chemical or metabolic stress like anemias or gut infections or blood sugar imbalances, your body is going to produce more cortisol. And when your body is making more cortisol, that is going to shut down the ability of your progesterone to have an effect on your cells. So cortisol kind of fights against progesterone, also drastically affects your thyroid expression. DHEA is also a very important precursor hormone from which you get some of your testosterone and some of your estrogens. Unstable blood sugar. If your blood sugar is going up and down, your hormones are going to be out of balance. There's no two ways about it. Inflammation. The area of your brain that drives your adrenal glands, the little glands that sit on top of your kidneys, and drives your ovaries is very, very sensitive to inflammation. The common thing with all chronic illnesses is inflammation. So we look very closely for these types of issues. For example, with autoimmune disease, where your immune system is attacking your own body parts, inflammation is going to occur. Food sensitivities, where you're eating foods and your immune system thinks that it doesn't belong in the body and it mistakenly attacks it, that will cause chronic inflammation in the body. Poor essential fatty acid ratios. These essential fatty acids, eating too many omega-6s versus too many omega-3s. Hidden infections. A lot of my female patients come in with chronic viruses, the herpes virus or Epstein-Barr virus, and they don't even know about it, and we have to clear that out of the body. Gut infections like H. pylori, infections, parasites, heavy metal toxicity, leaky gut syndrome. Dysbiosis is where your gut bacteria, the good normal flora in your gut, is out of balance. When that happens, you're going to reabsorb your estrogens and you're going to have a hard time metabolizing your estrogens. So estrogen is going to climb too high. And then there could be things like anemias, which are when you're not carrying enough oxygen to your cells. This is one of the biggest stressors to your body. Poor gut function, poor liver function. The liver is where you break down your hormones. The way the hormones work is you make them, you're supposed to use them, and then they got to go. You got to get rid of those hormones. You don't want them lingering around, and the liver is what gets rid of them. Poor thyroid function. Your thyroid hormone, especially T3. The thyroid hormone, thyroid gland sits in your neck, allows that corpus luteum, that part of the follicle, that once the egg is erupted from the follicle, it becomes the corpus luteum, which produces your progesterone. That is under the influence of your thyroid hormone and more. How do you know if you have any of these issues? So you have to understand that a lot of people are coming to me and they go to their doctor and they put them on hormones without addressing the underlying causes. And it's just foolishness, folks. Ladies, you can either address these causes or otherwise the hormones that your doctors are providing for you are only going to work for a short period of time. Proper testing, proper testing, proper testing. In my clinic, We also do very comprehensive blood work, and we look at your thyroid markers, all of them. That is another topic, but it is very misunderstood function, and it's often very misdiagnosed and underdiagnosed. We do the 28-day hormone testing on all of our cycling female patients. If you're in menopause, we're going to do a one-day hormone test and see what your estrogen and progesterone levels are, because they don't fluctuate. We can test it in one day. This 28-day test, the hormone test, is very good, ladies, for those of you who are perimenopausal, like if you're in your mid to late 40s, because we can see exactly where estrogen is dropping or where the progesterone is dropping, and then we can use bioidentical hormones to get them up, of course, always addressing the underlying issues. We do food sensitivity testing, organic acid testing. We check for heavy metals and mineral imbalances. We look at the stool to see if you have infections or dysbiosis in your gut. And we also look at your adrenal hormones. Folks, have you had any of these tests? A lot of you haven't. And I want to tell you why. And the reason is because your doctor is following an insurance-based model. His or her hands are tied, and they're not looking at everything. Honestly, they're not really interested in all of these things, because medicine is all about treating symptoms and not their underlying causes. And that is not what we do here. We treat the underlying causes. We want to find out why. So maybe you've been told that all your lab tests are normal, which we hear a lot. This is very common, and the reason you may hear this is because lab ranges are inaccurate. And I want to explain that. The way a lab determines its ranges is they take the average low and the average high of whoever's been in that lab for the last year. Well, let me ask you, what kind of people go to labs most? Sick people or healthy people? Well, they're usually sick. Sick people go to labs more often. So these ranges are based more on sick people, and we don't want to do that. We have to use functional lab ranges. So if you're here or here, you're going to say, if you're here or here, they're going to say you're normal, and we're going to say you've got a problem. So if you drew your blood of 1,000 healthy people, they're going to be in this range, not on either side of that. Okay. So for example, let's look at TSH. All right, which is one of the only markers that they run on the thyroid regularly to check thyroid issues. TSH, thyroid stimulating hormone, most labs will say that 0.3 to 5.7 is normal. So if you're at 4.2, your doctor's going to say you're fine, whereas functionally healthy people would be between 1.8 and 3.0, not just the average American. We're going to say you have a thyroid problem if you fell in that 4.2 range. So it is really important, and a lot of things get missed if we don't look at it right. Again, I'm going to reiterate that if you're on hormones, you do not want to look at your hormones using blood work. You want to look at it through saliva or urine. They're falsely low in the blood work. All right. Now, the other thing I want to mention is that different women need different amounts of hormones. And usually women who are shorter, heavier, with larger breasts need more estrogen and progesterone. The reason why they're shorter and have larger breasts is because when they were younger, they typically had more estrogen in their body or from their environment. Higher amounts of estrogen will cause your growth plates to fuse early in life, so you have shorter stature, and then obviously estrogen is all about growth, so the breasts will be larger and things like that. So they probably need more estrogen and progesterone for the rest of their lives. So that is another reason why you can't really go by ranges. You have to go by symptoms too. With women, you have to, you give them some estrogen and progesterone. If they don't feel good, you've got to get them a little bit more or a little less if they're that type of body type. And then taller and thinner women with smaller breasts may need a little bit less. That's just a general rule. It's not hard and fast. Okay. Now, what we see and what we measure and what we do when we do the 28-day hormone imbalance test, there are usually 3 different stages. There's poor distribution, which means that you're making enough of your hormone, but you're not making enough of it at certain times of the month. In other words, if you measure the amount during the whole month, it is okay, but there are certain periods of the month where you're not producing enough of it. So you'll have irregular shifts in these hormones. Stage 2 is where we see this in menopause. It's a low output, where you're just not making enough. This is usually progesterone, and as I'm going to mention again later, you need about 25 to 40 times more progesterone in your body than you do estrogen. So let me spend a minute here talking about birth control pills with this point, because the purpose of birth control pills is to prevent ovulation so that the egg does not erupt from the follicle. And folks, this is a great source of contraception. There's no doubt about it. It works. However, what you're not making then is that corpus luteum. That corpus luteum is a follicle without the egg. Well, if you're not ovulating, you're not making that corpus luteum. And remember that corpus luteum, this thing right here, the yellow body, that is what produces your progesterone. So typically, females on the birth control pill have what we call estrogen dominance. They have too much estrogen compared to how much progesterone they have and that they need. And that causes a lot of problems. And women are meant to ovulate. It's just a fact. You're meant to ovulate. And it causes a problem when that system is suppressed or shut off. Now the third stage is where the timing of ovulation can be off. And that can set a whole bunch of other problems in motion. Now, 50% of female hormone imbalances can be fixed by addressing the adrenal glands. So a lot of you don't even need hormone replacement. Just fix the adrenal glands. And the underlying causes to adrenal problems that is not making those adrenal glands work very well, and we can get your problem under control. The adrenal glands are responsible for about 35% of reproductive hormone production in premenopausal women and about 50% in postmenopausal women. Folks, that's important. The progesterone levels are often affected to a greater extent than estrogen levels by adrenal exhaustion, creating a state of estrogen dominance, even in women with low estrogen. When we talk about estrogen dominance, we don't necessarily mean you have a lot of estrogen. It means you don't have enough progesterone to balance it out. So progesterone balances estrogen. It is very important, and that is how these hormones work. So normally you need about a 25 to 1 or even a 40 to 1 ratio of progesterone to estrogen. All right? So you could have low estrogen, but if you have even lower progesterone, you have estrogen dominance and all of the symptoms that go along with it. So the symptoms of progesterone deficiency or estrogen dominance, anxiety. When I get patients coming in that are women and they have estrogen dominance or low progesterone, we put them on hormone replacement, bioidenticals, either sublingual or creams. Within a week or two, their anxiety goes away because it has a great effect on certain areas of your brain. And we see here regularly, there are periods where the timing of the periods will be off. Hair loss is very, very common. That and the thyroid. The progesterone and the thyroid work together. Cramping, acne, low sex drive, mood swings, depression, excessive bleeding, all due to estrogen dominance. So estrogen excess is similar to low progesterone symptoms. When you think of estrogen, think of extra growth. So we'll see breast swelling and breast tenderness. So you'll get larger fibrocystic breasts, water retention, craving for sweets, uterine fibroids, cystic ovaries, anxiety, nervousness, endometriosis, very, very common. Endometriosis means you have endometrial tissue in areas besides the uterus. A lot of women have that, and that tissue will start to swell or become a problem if you have estrogen excess. Heavy irregular menses, heavy periods are usually due to extra estrogen or estrogen dominance. And again, women with estrogen dominance, that doesn't always mean that you have high estrogen. It means you don't have enough progesterone to balance it. Fatigue, weight gain, mood swings, low thyroid symptoms, because high estrogen really messes with your thyroid function. It affects your thyroid hormone drastically. And the doctors do not check for this. So if you're gaining weight, losing your hair, you're bloating, you have got tenderness in your breast, cystic ovaries, uterine fibroids, all this stuff can be prevented or helped, or you can even get rid of it if you balance and find out what's wrong. So the solution to estrogen dominance or progesterone deficiency, we use bioidentical progesterone, either sublingual or creams. I keep stressing that because we're going to talk about it later a bit more. And usually we use that in the second half of the cycle, the luteal phase. We have to clear out your excess estrogens. Estrogens are hard to get rid of. They're like Velcro. They have the longest half-life of any hormone in the body. So what happens is they go in the liver and they get metabolized and they become what we call conjugated. then they go into your gut, conjugate, and if your gut isn't working right, there's an enzyme in there that can deconjugate them, and then they can get reabsorbed back into your system. That is why liver function is involved. It's why your gut function is involved, because they get conjugated in the liver, and then they go out into the gut, and they come out, and they're supposed to come out in your feces. Folks, you have to avoid xenoestrogens. Folks, we live in a sea of estrogens, petrochemicals, exhaust fumes, pesticides, plastics, things that you put in your body, parabens and lotions, nail polish remover, lots of detergents. They have things that once they get into your body, they get converted into estrogens. Typically speaking, estrogen is never a problem. You have enough estrogen, meaning low estrogen is not usually a problem. You have enough, and it's usually progesterone that is too low, and that is where we see this estrogen dominant effect in so many females. You have to address the underlying metabolic problems too. The symptoms of estrogen deficiency or erratic production of estrogen is what sometimes we see, especially in perimenopausal females. Those of you who are in your 40s and you're still having your periods, but you're fluctuating a little bit, and you know you're heading towards menopause, hot flashes, night sweats, mental fogginess, insomnia, heart palpitations, yeast infections, depression, bone loss, dry skin, painful intercourse because you're not producing enough lubrication, low libido, vaginal dryness, headaches, memory loss, and incontinence. So estrogen, what we see in the perimenopausal female is you will have 2 or 3 days where it just drops, and then it comes back up, and we see these wild fluctuations. And the only way you're going to know what's happening there is to do that 28-day hormone test. Now, ladies, here's what happens with progesterone. Your body's ability to produce progesterone starts to decrease in your early 30s. And by the time you hit menopause, your progesterone levels are about 75% less than they were in your early 30s. But estrogen is not that way. And when you hit menopause, estrogen is usually about 30% less. So we have this discrepancy. Remember, you need more progesterone, 20 to 40 times more progesterone to function properly. So progesterone deficiency and estrogen dominance is usually the problem. But the only way to know is to do the proper testing. So the female hormones are major sources of progesterone. When you're menstruating, it is the ovaries, the corpus luteum, which comes from the ovaries, and especially that last half of your cycle in the luteal phase. Then when you're pregnant, that source of progesterone is the placenta. And there are a lot of theories now that are saying that women aren't having as many babies that they used to 100 years ago. And that is one of the main theories is why breast cancer and uterine cancer are higher. Because I say we, but I'm a male, but you need this time in your life, however many times you're pregnant, where you have high levels of progesterone. When you're pregnant, you have 3 to 5 times higher progesterone, so you have that for 7 or 8 months, and that is a very protective mechanism against cancer because estrogen causes growth. So you really lack estrogen during those times that you're pregnant. But women are getting pregnant less and less nowadays. And so that is one of the theories on why estrogen-fed tumors like breast cancer and uterine cancer are on the rise, because we're not having as many pregnancies. When you're postmenopausal, remember your adrenal glands produce a significant amount of progesterone. The effects of progesterone reduces tension in the body by improving the function of GABA, which is a calming neurotransmitter in the brain. It promotes restful sleep. It acts as a natural antidepressant and a mood stabilizer and reduces PMS symptoms, mood swings, irritability, cramping, and cravings. So the top five common conditions in premenopausal women resulted from hormone imbalances and PMS, and this is usually due to a sudden drop of progesterone in this luteal phase or the second half of your cycle. Premenstrual migraines may be due to a sudden drop in estrogen or progesterone. We don't know until we do the proper testing. Polycystic ovarian syndrome. This is where you're converting your DHEA or some of your estrogen and progesterone into testosterone, and your testosterone levels are too high, or androstenedione, which is another anabolic hormone. Infertility because you're not ovulating, and a lot of you are not ovulating and you don't even know it. And when you don't ovulate, you don't produce that corpus luteum, which means no progesterone, and you need progesterone, progestation, for a pregnancy to occur. This is very important. And there's also low sex drive. So you can see this is one of the tests that we run on our patients where this is where progesterone is off. Okay, it is low in the first half, which it should be, and then it comes up, and this one drops too soon. It should keep going on more and more and more, and then drop right here before your period. Right before your period occurs. Progesterone and estrogen are at their lowest at that time, and that is what stimulates the sloughing off of the endometrium for your period to occur. So this is someone that would need progesterone maybe in the last 12 days of their cycle. And this patient would do very well with that type of supplementation. So here we see in migraines where a sudden drop in progesterone comes back up, and that would trigger a migraine headache because of the effect on the brain, where we only would know this if we did proper testing. So ladies with migraines, this is an important aspect of finding out what's going on. Polycystic ovarian syndrome, or PCOS, this is where a cyst develops in the ovaries, and it almost always causes anovulation, which means no ovulation. So this is actually the #1 cause of infertility in this country. It is usually due to insulin resistance or blood sugar issues, and often see it with elevated triglycerides. We see estrogen and testosterone dominance in this disorder with an increased risk of diabetes, high blood pressure, and heart disease. We see weight gain, blood sugar problems, infertility. Often there's endometriosis, acne, fatigue, and those are very easy to correct once we find out where the imbalance is. Infertility. Again, this is where you're not ovulating. You have to look at all the reasons why you have to have the egg erupt from the follicle for that to happen. Libido. If your progesterone is low, or if all your adrenal glands are exhausted, then you're not going to have sex drive. That can come back relatively fast. The birth control pill. Folks, if you're using the birth control as contraception, I want you to know that's a personal matter, and I respect that. So we can work around that. But if you're on it because a lot of you females are on it from your doctor trying to normalize your cycle, that's really an artificial way of doing it. The birth control pill is synthetic hormones, and it is not real hormones. So there are consequences to that. You don't want to be on these all the time. Ladies that are on birth control periods for long periods of time are not producing enough progesterone, and later on they can have some very serious consequences. So with the birth control pill, often progesterone for the second half of your cycle is really going to help you. You've got to work on the liver to be able to detox these other hormones as well, so that's important. Now, let me just mention here that it is very important that you understand the way all this happened around hormone replacement therapy. In the 60s and 70s, all the doctors thought that all you needed was estrogen. Estrogen was the main hormone. So for all you women, when you got into menopause or had a hormone issue, they were getting estrogen, giving lots of estrogen. Well, they were synthetic estrogens. Here's the deal. Why would pharmaceutical companies make synthetic hormones? Why not just give them the real hormones? Well, the reason why, again, is because of money. They can patent synthetic hormones. They cannot patent a bioidentical, a real hormone. It exists in nature. It's like trying to say we're going to patent an apple. It grows in nature, so they can't make any money out of the real deal, the real hormones. So they made these synthetic hormones. Once they found out these synthetic estrogens were causing a lot of cancers and ill effects, they switched to another synthetic called Prempro or Premarin or Provera, which have artificial or synthetic estrogens and progesterone in them. This went on for a period of time. Now, Dr. John Lee, who I mentioned earlier about his book, was the pioneer who discovered this was causing a lot of problems. Now, don't get me wrong, these synthetics they're going to get rid of symptoms. The synthetics get rid of symptoms, and they will help you with your hot flashes, insomnia, and other symptoms. But what's the cost, ladies? So they did a study, and they called the Women's Health Initiative. You can Google that. Just type in Women's Health Initiative, look it up, learn about the study. They took tens of thousands of women, and they started the study in 1991, and it was going to be a 10-year study all the way to 2001. And they were looking to prove that synthetic hormones can protect against cancer and heart disease in the same way as one's own hormones. In one leg of the study, they gave all these women Premarin and Provera. Premarin, by the way, is a synthetic estrogen that they get from a pregnant horse's urine. Provera is a synthetic progesterone. So they put these women on the synthetic estrogen and progesterone Prempro. And they did the study, but they had to stop the study early. You know why? Well, the reason why is that they saw a marked increase in breast cancer, uterine cancer, stroke, and heart disease. They had to stop the study because women were contracting cancer and heart disease. And they thought back at all the millions of women that were on this medication before they did this study, and how many probably had developed cancer. Millions because of this. These synthetic hormones still exist today, Premarin and Provera, and doctors are pretty cautious about using them now. And you've probably even seen the commercials. It increases your risk of cancer, etc. So all this research was done on synthetic hormones, and that is my main point, not on bioidenticals. And bioidenticals do not harm the body. The body is used to these hormones. They're identical to what your body produces. Giving you bioidentical progesterone is totally natural, like giving you water. If it was dangerous, progesterone is 300 to 400 times higher when you're pregnant, and that means you'd be getting all kinds of problems if it was dangerous for your body because your progesterone levels are super high when you're pregnant. It's very safe for the body, and we just get wonderful results when we use that for women who need it. Now again, just to be perfectly clear, I'm going to reiterate this. I'm a chiropractor, said that before, and I don't prescribe you hormones. I let our nurse practitioner or medical doctor handle that. It is outside my scope of practice, and I don't want anyone saying that I told them to take hormones or prescribe them hormones. Again, just to be clear about that fact, okay? Menopausal management. We don't need to do a 28-day test for menopause. The ovaries aren't producing, so adrenal gland health is crucial. We measure via urine or saliva and maintain healthy levels and balance, right? And we look at these underlying conditions and underlying issues that you have to address, okay? All these underlying issues we talked about. Synthetic hormones. We talked all about the studies showing the ill effects of hormone replacement therapy for females, and we're done using synthetic hormones, not bioidenticals. All right, so I get this question a lot from my female patients when we talk to them about putting them on bioidentical progesterone. And they say, well, I hear that causes heart disease. No, that's not true. Those are synthetic hormones. That is comparing apples to oranges. They're safe, and the body is used to them. They're identical to what your body's supposed to produce. Premarin and Provera, we talked about those. They're synthetics. They're toxic and foreign to your body, so you must use bioidenticals. You must use saliva or urine to measure your hormones. There can be problems with progesterone creams. We can use creams, but we also like to use sublingual because there are logistical issues. It can be hard to dose right for creams, dosing accurately for some women. And it may rub off on your partner, so he may be getting some of that progesterone that he doesn't need, or even your children. So we use sublingual when necessary. We can use creams, but sublingual is available to us. So you have to watch out for something called xenoestrogens. These are compounds in the environment that convert into estrogen in the body. We find them in your water supply and in foods, estrogen mimickers, animal fats, non-green detergents, cosmetics, toiletries, spermicides, plastics, pesticides. Folks, these are everywhere. So the problem is usually not that we don't get enough estrogen. The problem is that we don't have enough progesterone to balance it. We always talk to our female patients that if you want to get pregnant, good health for the baby starts at least 100 days before conception. That is when your eggs, and in men the sperm, are actually developing, and in 100 days that will end up being the start of life. So it is important to start making sure you're healthy before conception. We like to say try to get healthy at least a year before. In the USA today, 1 in 88 children are diagnosed with autism and spectrum disorders, and a lot of that can be prevented if the parents take care of themselves. There's a genetic predisposition, maybe, that might be there, but those can be supported if the potential parents take care of themselves. So it is important to address nutritional, lifestyle, and environmental factors, especially toxicity. So we set up to have this stuff handled prior to pregnancy. For example, we would not want females to have any kind of dental work with mercury or removing any fillings when she's pregnant or prior to pregnancy. So women should minimize dental work during preconception periods and pregnancy. This may release toxins into your body that are going to end up in the fetus when you're pregnant. All right, that's no good. The life process begins 100 days prior to conception when the female and male germ cells begin the maturation process. This is when the sperm and the egg are most vulnerable to toxins, so it's very, very important to get rid of toxins. Options to increasing estrogen. All right, if you have that. We can use DHEA, which converts into estrogen, but you've got to be careful about it converting into testosterone also. You want to control insulin resistance. With your doctor, Biest is a really good prescription, or a nurse practitioner, for estrogen if you need it. Phyto-B is a plant-based bioidentical estrogen that we use, or DHEA, and it contains herbal combinations like black cohosh or dong quai or cramp bark, shepherd's purse, and others. These are what we call specific estrogen receptor site modulators that control how well these estrogens get into your cells. The options to increase progesterone, you really only have one, bioidentical progesterone, okay? Proper estrogen and progesterone balance has a huge impact on your brain, especially with this neurotransmitter GABA. A lot of ladies are telling me they are depressed or anxious, and that greatly improves once you restore the estrogen and progesterone balance. Hi, Older Me back again. Now, what's next? Please understand this. Knowing something and not doing anything about it is just like not knowing it. You need to take action. My team cannot help you unless you call us and make an appointment, okay? So we schedule you for 2 visits, and here's what we do on your first 2 visits. When you call and schedule an appointment, tell them that you saw this video in its entirety. We will not see anybody until they've watched this video or have seen us give a class on this information, because we don't have time to explain all this in our office. We're very busy, and someone cannot just come in and say, hey, I understand your office manages these type of problems. That won't work. They got to know what we do. We don't have the time to explain all this data one-on-one. That's why I make these videos. We're going to have you bring in any recent labs, okay? Bring in any recent labs. You don't have to run all over town getting them, but if they're easily accessible, bring them in. They can be helpful. When you call the office to make an appointment, they're going to mail or email you some very important paperwork for you to fill out prior to your first appointment. Fill it out before your first appointment. And at your first visit, we want you to bring your spouse or significant other. We need them to understand what is going on. You got to understand, if you're watching this alone without your spouse or significant other, this is affecting them. And you need to realize that they need to see that there are options out there for you. So on visit number 2, so this is visit number 1, this is visit number 2, we're going to let you know if we can accept your case. Now, what do I mean by that? Some people come to us and they're like, I don't want to make any lifestyle changes. I'm not going to make any changes. Just fix me. Well, I want you to know that's okay, but don't come see us if you have that attitude, all right? You'll waste your time and your money and our time, all right? And you have to have an attitude like, you know what, I'm sick and tired of being sick and tired, and I want answers, and I'm not getting any answers, and what you say makes sense. So if this doesn't make sense, if what we've gone over doesn't make sense to you, that is totally fine. But respectfully, we're likely not the right place for you. Honestly, this has to make sense to you. Otherwise, it's not going to be worth it. So on visit number 2, we're going to go over any and all further testing you'll need to do. So we're going to review everything that we found in visit number 1, go over into further testing that will need to be done. We talked about all the testing that someone might need. We're going to review what we think you're going to need. And we're going to overview your treatment plan. Most of our metabolic patients are managed in our office for 6 to 12 months. Usually after that time period, you don't need us anymore. We'll have it figured out and we'll teach you. This is a teaching program. When you come see us, you're going to be taught. We're going to identify the underlying causes, and we're going to teach you how to manage that for the rest of your life. There's an old saying, you can give a person a fish and feed them for a day, or you can teach him how to fish, and he'll feed himself for a lifetime. Nothing pleases our team more than to run into a patient we haven't seen for years out and about, and we hug and kiss and cry or whatever, we high five, and they tell us how good they're doing, how good they feel, how their life is better, or better yet, their kids tell us mommy or daddy is better. That makes everything that we do worthwhile. The stuff that we do is not easy. It's taken our team thousands of hours of postgraduate studies and hours in independent study to learn all of this. And this is the benefit you're getting when you come to see an office like ours. We're going to overview your treatment plan. All right. How often do you need to see us? It varies. If you have musculoskeletal problems, we might need to see you more frequently. But typically, for metabolic problems, a patient is going to come in to see us about twice a month. On the second visit, we're going to overview any financial obligations that you have. What is it going to cost you? And I'm going to give you a rough figure in a few minutes of that. On that visit, we want you to bring your spouse and significant other as well. Why do we want them on the second visit? Because we're going to go over what's wrong or what we found. We're going to go over what it's going to take to get you better and what it's going to cost. We like to be transparent, and you should come in already having a pretty good idea what it's going to cost, which I'll go over here shortly. So to recap, what you need for your first appointment. You need your paperwork filled out completely. Bring it in filled out. If you come in and we reserved an hour for you and you don't have the paperwork filled out, we may not have time to see you. We have a busy practice and we do everything we can to run on time, and you filling out the paperwork on our couch will eat into that time. You'll be happier if you use your couch at home to fill it out ahead of time. Again, on that first visit, we want you to bring your spouse or significant other and have them there. If your spouse is involved in any way, shape, or form in your health and your decisions, then we want him or her to be at this appointment with you. It just works that much better. All right? So here's the offer that I'm going to make to you. We only accept 10 new metabolic patients per month. That's all, 10 per month. We don't just jam up the schedule, leaving the provider team no time to see you and help you. That's no good. So we keep our patient load limited so we can give the best care possible. Right? The cost of these two visits that I just went over, these two here, the cost of those two visits is $550. If you make an appointment after watching this video, then that $550 is reduced to $170. And that does include the first visit's lab work, okay? So here are our rules. There's just some rules we have. We want to be very clear. You've got to be willing to make some serious life changes. Something's got to change. If you keep doing the same thing over and over and over but expect different results, you're going to go insane, all right? And I know that's been happening to some of you. You just don't know what to do. That's what people hire us for. So when you do what we recommend, it'll work because it's not guesswork. It's going to be based on what we see in the lab work. So you've got to be willing to change some things in your life, folks. That's just the way it is. Please don't shoot the messenger. It's just a fact. You have to take accountability for your health. Can't blame your parents, can't blame your spouse, your kids, the president. It's you. And once we teach you, then it is up to you. Now, we do accept insurance in our office, but please understand this. Please understand this very clearly. Insurance does not cover all of this. It actually doesn't cover much of it all, if anything. And I mentioned why earlier in this video, if you recall, so I'm going to give you a rough guideline. If it's not worth $300 to $500 per month for 18 months, we could do an 18-month payment plan. If it's not worth $300 to $500 per month for 18 months, now you're not under care for 18 months. I mentioned that. We usually see patients for 6 to 12 months, but we can stretch out the payment plan. If it's not worth $300 to $500 per month to you, potentially interest-free for 18 months, then we might not be the place for you. I'm giving you a rough idea of what it costs. Now, some patients will pay it all up front and they get a discount. And we'll go over exactly what your care is going to cost on your second visit. And just so you know, you're under no obligation. You could do whatever makes sense for you, but it does have to make sense for you, okay? Now, you should ask yourself, all right, on a scale of 1 to 10, how serious is your illness? What you have is a chronic illness. They don't get better on their own. They only get worse. Nobody has a magic wand here, okay? They're going to change. It's going to get worse over time. So where do you see yourself in 1 to 3 years from now? You should look at that. Where do you see yourself from 1 to 3 years if nothing changes? Due to time constraints, we can only accept those that are truly committed. You'll be amazed at how healthy you can get once you go to someone who truly understands the underlying causes and addresses those causes. So I hope this makes sense. If you're watching this and you're ready to really make a change in your life, please call our office, make an appointment. Let's get started. We hope to see you soon.